Here we will see the relations of liver. In the anterior relation, you can see the picture clearly. The liver here is anteriorly covered by the xiphoid process, the costal cartilages and the rib. Then obviously the anterior abdominal wall is also anteriorly covering the liver. Then part of the diaphragm is also extending into the anterior surface. That is the anterior relation, xiphoid process, anterior abdominal wall, diaphragm. Along with the xiphoid process, you can see the rib and costal cartilage. In the posterior relation consists of concavity of the vertebral column and bare area with the adrenal gland, groove for the IVC, caudate lobe and impression of esophagus. We will see the structures first. Here is the area for the vertebral column. So, near the vertebral column, you can see the caudate lobe. Then near the caudate lobe there is IVZ, and this area is the bare area of the liver. Bare area is bounded superiorly by superior coronary ligament, inferiorly by inferior coronary ligament, and on the right side by the right triangular ligament. This we already explained in the other video. Then when the vertebral column comes here, obviously the esophagus is also comes at this level, because the tube which is related to the vertebral column is the esophagus. Then regarding the superior surface is related with diaphragm. You can see the superior surface with diaphragm. This is the area of the diaphragm that is present on the superior aspect of the liver. So, this diaphragm is separating the liver from the lung on either side in the upper part with the pleura, and also the heart that comes in between the two lungs. The heart is covered by pericardium. So, the structures which is separating the liver from this lung, pleura, and the heart and pericardium is the diaphragm. Diaphragm is separating these structures. Regarding its inferior surface, listen, this picture shows two surfaces, posterior as well as inferior. So, the posterior surface, say the posterior surface is towards the upper part. You can see, I will label the posterior surface that starts from here and ends here. Okay, this is the posterior surface, and the remaining part is the inferior surface. Inferior surface first consists of the gastric impression. Here comes the gastric impression, then the first part of the duodenum, because stomach is continuous as duodenum. So, the first part of the duodenum, then in between there is ligamentum teres comes here, ligamentum teres, the space for the ligamentum teres. Then you can see the quadrate lobe. Next to the quadrate lobe is the gallbladder, that is the gallbladder. Then this area is for large intestine. So, here comes the hepatic flexure of the colon, colic impression. Then this area is for right kidney. So, when the right kidney comes here, the upper part of the right kidney consists of suprarenal gland that goes to the superior surface. So, that is related with the bare area of the liver. So, right suprarenal gland is not the relation of the inferior surface, but that is a relation of the posterior surface, because inferior surface consists of renal impression. So, the suprarenal gland that present above the kidney is going to the posterior, or that comes at the posterior surface of the liver. Once more, here comes the gastric impression. Gastric impression continues as first part of the duodenum. So here we can see the first part, impression of the first part of duodenum. Then in between you can see the ligamentum teres. Then there is quadrate lobe. Then gallbladder, colic impression, right renal impression. This is about the inferior surface. This is the same picture showing the different organs comes there. Here is the stomach, first part of the duodenum. Then this is the ligamentum teres. Then this is gallbladder, quadrate lobe. Here comes the colon, the right kidney, and suprarenal is not present to the inferior surface, that is extending to the bare area of the liver, that belongs to the posterior surface. Then regarding the blood supply and other supplies, blood supply, 80% of the blood is supplied by portal artery and 20% by the hepatic artery, because the end product of digestion has to be stored inside the liver. So 80% of the blood of the portal vein is carrying the end product of digestion, and that is stored inside the liver cells. 20% is supplied by the hepatic artery. Then venous drainage is by the hepatic vein, and lymphatic drainage is by hepatic lymph node and celiac lymph node. First the lymph drain into the hepatic lymph node, then finally it reaches the celiac lymph node. Now supply is obviously the sympathetic and parasympathetic because it's a visceral organ. Next is hepatic segments. Anatomically we have two lobes, the right and left lobe, but physiologically or functionally the number of lobe is different, that we cannot see with the naked eye from external aspect, because function wise the right lobe is again divided into right anterior, right posterior, the front and back. Right lobe of the liver is again divided into a front portion and a back portion. That this is a physiological classification, not the anatomical classification. Then left lobe is again divided into a medial part and a lateral part. So left medial, left lateral. So altogether the hepatic segments are anatomically 2, functionally 4. Then regarding the functions, metabolism of carbohydrate, fats, protein, synthesis of the bile, prothrombin, excretion of drugs, toxins, poison, cholesterol, bile pigments, and the storage of glycogen, iron, fat, vitamin A and D, antibody formation, as well as phagocytosis function. Then in histology, histology is the structural, the microscopic structure of the liver. Here you can see a slide showing the histological features of the liver. In this slide, what you can see is several hexagonal lobules. Numerous hexagonal lobules are visible. I will show one hexagonal lobule, then this is another hexagonal lobule, here comes another, here comes another. Okay. If you are taking each hexagonal lobule, the name of these lobules are called hepatic lobules. If you are taking one hepatic lobule, you can see the center of each hepatic lobule has a vein. The space consists of a vein, and this is called the central vein. The central vein, from the central vein you can see numerous structures are radiating, that you can see in yellow strand like areas. These are rows of hepatocytes, hepatic rows, hepatocytic rows. The cells, the liver cells are arranged in each columns or each rows. Between these hepatic rows, hepatocytes, you can see a space that is visible in a white color. That space is called sinusoid, and the wall of the sinusoid consists of a special phagocytic cell called Kupffer cell. Kupffer cell is the phagocytic cells of the liver which is present along the walls of the sinusoid. So sinusoid is present between the rows of hepatocytes which is radiating from the central vein. Then among the hepatic lobules, between hepatic lobules. So hepatic lobules are these hexagonal lobules. Among the hepatic lobules there is a space That space I will mark in green color. If you are examining the space, you can see 3 structures are present there. These 3 structures are, one is a branch of portal vein, other is a branch of hepatic artery, then the third one is the branch of the hepatic duct. So these 3 structures constitute portal triad. These 3 structures are called portal triad. Then we move to the clinical aspects or applied aspects of the liver. The conditions of the liver, the clinical conditions of the liver are the cirrhosis of the liver, liver cirrhosis. Here shows the cirrhosis of the liver. The texture of the liver become fibroid, the soft texture of the liver become fibroid. And another condition is hepatic carcinoma. This is the area showing hepatic carcinoma. The change of the cells are like this, hepatic carcinoma. Then the first segment, this shows hepatitis. So we can write the hepatitis, liver cirrhosis and liver carcinoma. Then another condition is rupture of the liver. Rupture of the liver is due to some accidents in which in case of rib fracture that may penetrate into the liver and that causes severe bleeding. And this is a slide showing tumor of the liver. So that is about the structure, the relations, subplace as well as the clinical conditions of liver.